Hi everyone, my name is Dr. Parky, a clinical psychologist. Welcome to the video. Today I'm going to talk about a fairly tricky symptom commonly seen in depression known as anhedonia, which is a loss of interest or pleasure in things we typically enjoy, like maybe in the past you really enjoyed playing the piano, really enjoyed taking those walks, really enjoyed spending time with friends, and those things just don't really give the same joie de vivre as before. It just doesn't really kind of have that same bang. It doesn't really give you as much of that meaning or enjoyment or fun. And as well, I'm going to talk about some strategies that we can use using cognitive behavioral therapy and other evidence-based therapies to hopefully break out of that symptom. So as I noted, anhedonia is one of the cardinal symptoms of depression. So along with low mood, loss of interest or pleasure in things we typically enjoy is one of the main symptoms that clinicians focus on when providing a diagnosis of depression. And for a lot of people, this loss of interest or pleasure is a kind of a tricky symptom because it's kind of hard to reduce in the sense that when you already don't have interest, it's hard to kind of add back that pleasure. It's hard to create something out of nothing. Okay, so let's talk a little bit about some of the strategies that can be helpful in the context of anhedonia, and the first one is called behavioral activation. So in the model of depression, usually what happens is that a person starts to feel sad and low and depressed, so they stop having the motivation or the interest in doing the things that normally gave them that sense of joy, which then makes them even more depressed because there's no more kind of positive reinforcers in their life, and then on the cycle goes. And as a result, one of the things that we focus on that pattern is that our kind of mood or emotions impact our subsequent behaviors. I don't feel like doing something. Something doesn't give me that same level of joy anymore. So therefore, I don't do those things anymore, which again creates that bit of a vicious cycle. So the idea behind behavioral activation then is actually to flip that script around, to actually say that our behaviors can operate independently from our emotions. We can not feel like doing something and still do that thing anyway, still spend a bit of time with friends, still, order our favorite coffee, still go for that walk, still engage in our hobbies. And obviously a person who's depressed, who experiences anhedonia, they're not going to have the energy to do all of those things at once. So what I would encourage you to do is actually pick something that you found a lot of meaning in before, found a lot of joy in before, and just practice with engaging with that exercise or that activity, even if it's in just small increments, to allow yourself to slowly refold and bring back some of those activities into your life. And what we find sometimes is that our mood starts to feel a little bit better. Like for example, when you really didn't want to go on that walk and you were really tired, but then your dog told you, hey, come on, let's go for that walk, and dog language. And then eventually you did go for that walk and you noticed it was actually quite pleasant. You noticed more energy after, and you actually noticed some greater amounts of positive emotions. So the same thing then happened even in the context of anhedonia, that with enough repetition, with enough sort of practice, you might start to notice some of those positive emotions start to come back. And I really want to highlight that this is a gradual and slow process. Do not necessarily expect that entire kind of like emotional experience is going to come out of it, that even if it's just a small amount of positive emotions, you're making your way up and you're kind of creating input into the generator to start working normally again. And somewhat related to what I was just talking about, the second strategy is known as cognitive therapy, or challenging unhelpful thoughts that kind of make it hard for us to break out of the anhedonia. So one thing that can happen is that when you're trying something new or you're reintegrating something you enjoy again, you might have the thought, that actually sucked. Like, this guy told me to do this thing, then that would make me feel better, but I actually don't feel any better. Like, nothing happened. And so, everything just feels kind of hopeless and worthless, and I just feel so helpless. You can imagine how some of those unhelpful thoughts and beliefs actually almost like create more of that depressive state, more of that rumination. So doing our best to stay non-judgmental about how we feel in relation to an experience. So not necessarily saying that if I just do something different, I'm going to feel way better. Just allow some curiosity to happen and target some of those unhelpful thoughts like, I should have felt better, or why didn't I feel better, or this is a terrible experience. Trying your best to navigate some of those unhelpful thoughts and beliefs. And related to that, some thoughts even make it hard for us to even get started in the first place. Like, that's not going to do anything. It's not going to work. I'm not going to feel any better. And as a result, you're not going to engage in the helpful behaviors that might be useful. And even if that belief has some validity, that it is right on certain occasions, it's not a particularly helpful thought. So instead of focusing on is the thought valid, focus on, is the thought useful? And in this case, if the thought serves you to kind of keep you stuck in your current chair and not doing anything, then it's not a particularly helpful thought, and we should probably act sort of opposite to whatever that thought or emotion is saying. And alongside letting go, or at least not following some of the unhelpful thoughts and emotions, do your best to, strategy number 3, stay mindful of positive emotions. When you're sitting underneath a tree with your favorite drink, looking at the nature and the birds, doing your best to just stay mindful of any positive experiences that come out of it, any feelings of lightness in your chest, any sort of positive emotions, maybe sort of a small inching of your mouth into a smile, even if they're just in the tiniest little way, to stay mindful, not forcing them to happen, of course, but just seeing if anything is coming up from those experiences. And again, if nothing is, do not be judgmental of that experience. You're dealing with a symptom of anhedonia, and it's okay if at that time you're not experiencing anything kind of crazily wonderful in that moment. The next strategy is to deal with any sort of personal or environmental factors that could be contributing to your lack of ability to have sort of more positive emotions. Like, for example, chronic stress or work burnout or poor sleep. All these factors can kind of create a sort of environment where your body or your mind is just not ready to experience the positive emotions. So obviously it's easier said than done, but if there are ways to create some separation between work and rest, be able to have a little bit more of a regular sleep schedule, do all the things that are needed to give you a little bit of that sort of nourishment back, engaging in the behaviors that you know will kind of give you some nourishment, like for example, getting better sleep, engaging with friends and family, just having some time to veg out and read your favorite book. Anything can be fine as long as you're able to kind of notice if work burnout or chronic stress is part of the equation, to be able to reduce some of these factors and hopefully allow for some of the positive emotions to unfold. The next strategy, I don't know what number we're at anymore, is to bring out social support. So sometimes if you're feeling anhedonia, things just don't feel kind of enjoyable anymore, you're not going to have much motivation, and if you're experiencing other symptoms of depression like low mood and fatigue, it's going to be even harder. But bringing social support can be sometimes helpful, so that you're not just kind of committing responsibility to yourself, now you have committed responsibility to another person. So you can't just say, oh, I'm too tired, I can't go, because your friend is waiting for you at brunch or waiting for you to go on that small jog or that small walk. So being able to leverage social supports or other people as needed can be a great way to kind of make sure that you're able to engage in the activities that you plan to, instead of saying, oh shoot, I didn't do that thing and now I feel worse about myself, and that kind of contributing to the anhedonia or the depression. And the last strategy I'll talk about is that if you find that your depression or your anhedonia is particularly severe, pharmacotherapy or medication can be quite a useful supplement to other types of lifestyle or therapeutic strategies. So perhaps talking to your family doctor, your physician, about possible antidepressants or other medication that may be useful to be able to support you from that other pharmacological perspective. So hopefully some of these strategies gave you a few things to think about, or something that you could try out for the next little while. I know anhedonia tends to be a pretty sticky and challenging symptom, so do your best with it. And if you are needing more professional support, I definitely encourage you to look for a therapist, chat with your family doctor to be able to get additional support for this symptom. By the way, if you're interested, my new book, Room for Therapy, well, it's flipped here, so I'll get my editor to throw it somewhere on the screen, is now out. It talks about all the strategies that I find quite helpful with patients when I've been working with them in terms of improving their mental health. So if you're interested, check it out. I'll put in the link in the description below. But otherwise, thanks for watching as always, and I'll see you in the next one. Bye-bye.